From the end of 2013 up until 2015, West Africa was heavily hit for the first time by an Ebola epidemic. This affected 3 countries in particular: Guinea Conakri, Sierra Leone, and Liberia. It is estimated that more than 28,000 people were affected, 11,000 lost their lives, and gracefully about 16,000 survived. My name is Isaac Marcus Carter. I'm the host of Radio Maria Liberia program, The Health Talk. This year, 2024, marks the 10th anniversary of the declaration of the Ebola epidemic. And to talk about this, we have Brother Peter Lassana, the director of St. Joseph Catholic Hospital in Monrovia. So, Brother Peter, welcome. Ebola, 10 years. Do you remember when Ebola arrived in Liberia? How was it like?
The issue of the Ebola outbreak in Liberia, brother, was a terrible scenario and situation. When the Ebola came or hit Liberia, people were not prepared. People were not too sure or were not convinced that that was Ebola. And by the time they realized that that was real Ebola, the disaster was there. Our sanitation system in the country was bad. No water for the people, no electricity around. And so when Ebola hit Liberia, especially in Monrovia, markets were closed, schools were closed, even hospitals were shut down.
So when they entered the hospital, the St. Joseph Catholic Hospital, how prepared was your staff?
And so when it entered at the St. Joseph Catholic Hospital, we were also ill-prepared. It came when a patient visited with some bleeding and people were doubting. We are saying it is Ebola. Some people said it's not Ebola. And that was when the commotion between the patient relative and the staff at the emergency room drew the attention of Brother Patrick, who was then the director of the hospital. When the Brother Patrick came, he is a medical person also. He looked at the patient and said, oh, that was not Ebola. It was maternity case. And this patient was rushed to the maternity only for her to die after 2 days. And when she died and was tested, it proved out that it was Ebola. And that is when the staff became aware that Ebola was really in the country. Gradually, Brother Patrick died, followed by Brother Miguel, who was the superior of the community, followed by other nurses, and some people who are very strong enough, like Marvin and co, survived.
In 2014, when the Ebola came into Liberia, I was one of those that contracted the virus while I was giving care to the late Brother Patrick Nshanzi, who was the hospital director, and he was also a best friend of mine. I personally helped him to the end of even putting on ambulance to carry him to the ETU. After the death of 9 President, late Chantal, the late Brother George, the late Lorraine, and after the loss of them, everybody went through the trauma because we were all together like one family. And up to this time, and many people still have that thinking. They sent people, they came, they took our specimen on the compound, they carried. They brought the result one morning and they called me. And the woman said, your result has come, you are positive. I got traumatized to the extent that I couldn't really hold myself because of what I saw. I saw people lying down with blood all in their mouths, people down, dead bodies, and people crying, and others just helpless. And myself, I almost died in night too. I had a real respiratory distress. God helped me in the night pass, and I came through. That's how I was discharged, and then I went home, people carried me, they escorted me to my house. The people in the community came in large numbers around the Chastera area there. They were all on the cold tide with leaves in their hands and jubilating.
What was the after effect? How did you guys handle the situation as a management and leadership of the hospital, losing firstly the hospital director? How did they affect the leadership and how did you manage it?
As a result of that, looking at the shock of it, the hospital was forced to shut down for a period of time. And that moment, nobody was ready to support the system by then. But there was no way out but to mourn the demise of these our brothers and sisters who died in the cause of serving other people during this Ebola outbreak.
After the death of 9 persons from the hospital, including Brother Patrick, the hospital was deserted because people felt that it was just Ebola camp. So nobody could easily come to the hospital anymore. There was hard struggle. Until Brother Patrick came in and started to do a very good job by telling people to carry awareness that the hospital is good.
So within that period, when they closed, we looked at the possibility of how to come back and reopen the hospital. Many people, aside the expatriates, brothers and volunteers who came to help with the reopening of the hospital, we have also very courageous Liberian staff who was in the forefront to ensure the reopening of the hospital at the maternity unit.
When the hospital director died, it was very frightening. Psychologically, it was a great trauma for the hospital. We needed to start bringing staff back to their mental status, encouraging them, making them to understand what the disease can do, what it can do, how you can get in contact, how you can catch the virus, how the virus can be spread, so that they be more confident to come back to work. We opened in November. It was not an easy thing. People still had the fear despite the training that we have had previously. So we went back to normal activity, but not 100%. At that time, we're only running the maternity ward. So we needed to open the maternity department because that involved 2 lives, the mother and the child.
It was a service that was open at free service for pregnant women. It was necessary because people were not working. When the first cases were delivered successfully and the staff were still remaining healthy, the population started coming. You will see Liberian staff with their doctors sacrificing to enter into the PP and the red zone to conduct delivery for these people.
After that, I rested for some time, and then I decided to come back to work in the hospital again. Because my aim is to help people too. So that's how you find me today. I'm in the hospital working. Okay. When I entered the hospital the first time, I was sad. I was not really normal like Marvin before. What I learned from this is that as a professional person on the field of medicine, you don't have to be afraid to quit what you are called to do. The first thing is you put God first and do all you can to save lives. So you have to stand there and do just what you are called to do, no matter how the situation intensified.
Brother Peter, so let's digress a little bit. Let's talk about Nuku Town. You know, Nuku Town in Liberia it has a very, very large slum community population. Why did you decide to create another center in that densely populated area?
If you go to Nuku Town, you will see the massive need of the population. there could be in a small house like this more than 5-10 family members living there. You could just imagine when the Ebola outbreak occurred, Newtown was highly hit. This is a densely populated community with no source of income, that needs water, that needs sanitation, that needs proper health care delivery services. You can just imagine when there is an outbreak in that community, how the community will suffer. And at that Newtown, that is where we find ourselves rendering service to this community. We call the hospital the small Catholic hospital. But then, Ebola had been declared ended by WHO.
After the Ebola, there was revamp, where you see the big well you see there. Yeah, the talking after Ebola, they put it there for water. They had a Palawa hot, no triage. They have the isolation room, just in case, for preparedness. When you go into the community, sometimes you find the children, they're sick. When you ask the mother, why you can take to hospital or to the clinic, say, I get money. And you see her sitting down, even the first food to eat is not available. So for those babies that are coming under the teenage girls, most of them underweight, they are malnourished. Reason being, sometimes they come to the clinic or you go out on community engagement and then you ask, what food you giving this child? They will tell you, I gave my child cocoa. At the end result, you see them, they malnourished, they underweight. So because of that, we talked together with Brother Peter and then we started doing the feeding and the weighing. Because as per your age, your weight counts. We have our PHC day. That's for the pregnant girls, teenage girls, children, but we see other patients. But we do our community engagement every last Friday. So we visit them accordingly to do some health teaching on the importance of visiting the facility. Sometimes in a month we invite them to come to the hospital where we do the training. Especially when we started the food, how to the food for breastfeeding, how to give them the food, how to teach them to make the rice. To a good extent, they are picking up because we give or you give what you can afford. So like for us now, we try to give them the plumping nut. So we tell them the importance of visiting the hospital at least once a month, at least.
We open it to the population to cater for those children and women who are suffering.
Thank you very much, Brother Peter, for having this discussion with us. We will now connect with Lone Star in Sierra Leone, where our brother, Michael Kuruma, head of the St. John of God in that country, will tell us what the situation was like there during the Ebola epidemic.
Ebola effect, schools were closed, markets were closed. In fact, movement was difficult. Even the lumas with the market days were not going on. Government has to ban them because Ebola does not like gathering. When you are gathering together, it's the easiest means of spreading the virus.
Good evening, good afternoon, and good morning. It all depends to where you're getting us. This is Lone Radio Frequency Modulation 99.1. On a special edition, I'm having with me in the studio Brother Michael from the St. John of God. And we are going to discuss about Ebola as it has happened for almost a decade. And we'll be having a discussion with Brother Michael on how it comes about, what were its effects, and the rest of it. During that period, what actually happened in the hospital?
I met the fact that on the 13th of June, a patient came from Gambia and entered our hospital. And from that point, the hospital started experiencing the panic of Ebola virus entering into the hospital. We lost about 13 staff died in our hospital. The people never even believed that Ebola virus was existing. It took time for me to convince even my staff to believe that the Ebola was a virus that does not have cure, and the staff were confusing the virus appearance to malaria, they are confusing it to hepatitis, and this was a very big challenge. The people realized that, oh, Ebola is around. And especially when our doctor died, Brother Manuel Garcia Viejo. By then, people were dying in Lonsa town. The health team never had resources, what to do, how to stop the death. We discussed further how St. John of God could come in to help to reduce the mortality of people in this town.
I started working at the emergency in this hospital, St. John of God Hospital. When the thing started, then we had one of my colleagues died. Two of the other nurses in the emergency fell sick. I fell sick. So two of us were admitted. Everybody was panic at home. Then they took me along. I needed to die by the moment because it was not easy for me.
The government was not having the capacity because it would take you from Lonsa to Kenema, which is about 5 hours to take a patient or take your sample, and you get the result after 5 days. I mean, if you are positive, before they will know, you have died already. About 4,000 people died in Sierra Leone.
Just imagine that 9 days I was going without food. I saw people standing, waiting for my results outside when I came. Then finally, Dr. Khan called me and told me about the results. Test they made was negative. So the hospital did a very good thing. They make me feel belong, providing a vehicle to go and collect me in such an incident. They make me feel proud. I was there thinking of my husband's dead, then everybody that was close with me is dead, almost everybody. So I was alone. So when I come to the hospital, I feel a bit relief. I like taking care of sick people. I really admire people taking care of sick people. That's why I decided to be a nurse. What is it? At first, when I was a kid, I used to play with them, taking care of babies like that. So then my people always called me nurse. I walk so fast. I tried to be a trader, selling some goods, but I could not. So I have to go back to my career that I wanted. In the end, I decided to be a nurse. I'm going to try. Then I come back to the St. John of God. Then I applied. They employed me as an auxiliary, helping. You know, some people, if you don't come closer, they will not explain their problems. I come closer to the patient so the patient can tell me the problem. I say, what is it? What is your problem? I just imagine pain. Pain is just like stress when someone is having pain. So you have to encourage that person. You have to talk. Even if the pain comes, you will think that someone is by my side, talking to me or making me feel better. So I should cooperate. So that's my role right now.
What was actually the other phase of your job that was you having during the Ebola epidemic?
My principal task at that time was to look out for resources because I needed to contact people outside Sierra Leone to help me with financial resources, to buy local materials which we could use, to buy food which I could use with my team to support the people who were quarantined. So people said, okay, let's stay in the house, we'll take care of our sick relatives. So they were there, people were dying, they were burying the people, and they were getting infected. The whole family could die, the whole generation died.
We were having one of our sisters here. She was a nurse working for my Besene. She got sick, so the lady died. Most of us in this compound went there to sympathize. A week later, the way they see the massive death, then they said, oh, this one is not no more witch plane or witchcraft issue. So it is the Ebola. Within that same time, my stepmother and this of my sister died the same time. So they bring in some military men, they guarantee the entire labor camp. People were dying out, whilst I was a victim burying these people. So there I got infected and I was with this of my woman. Within the process, we lost a lot of our relatives, including the entire labor camp. I remember straight away those that I've lost. Yes. And let me say, it takes me time before I left crying for them. But the first people that was taking help, it was St. John. They were giving us rice, cloths. They backed up with medicines also.
I was the director of the hospital, but I went beyond that. My office was not inside the hospital. My office was outside. I want to thank organizations like Juan Ciudad. And one of the projects they helped us greatly was to feed these people who are quarantined. Because if you keep somebody to stay in the house, you say don't move. I have to help the person to get food, to get water, to get firewood, and to get even radio and get a battery to listen to news and sit down until the 21 days was over. So with these interventions, the community people became relieved.
When I got sick, any sick that is very complicated, I normally go to my Besene. Even unto my children, when they are sick, I go to my Besene hospital because it is the big hospital for us here.
Now it's been a decade since the Ebola epidemic hit Sierra Leone. So based on those 10 years as the director of St. John of God Medical Health Hospital, what actually is the experience you've gathered?
After the Ebola epidemic, I realized that the people needed health service in the community. And more so, maternal and child health was a problem, and it's still a problem in our country. The hospital is providing free medical services to under 5. The hospital is providing free medical services to pregnant women. As those who join the maternal and child health program, they receive it. the people will testify themselves. So far, what the St. John of God brothers have done in order to alleviate, to improve the health status of our people. So we as a hospital, when we decided to feed the people, go out to the community, that was the time we started our primary health care. We came to realize that it was very, very necessary to embark on preventive medicine. People are in the rural setting, they don't have health facilities, health services. So this was how St. John of God, we came up with the idea of going out to start the primary health care. Up to today, I think we are celebrating our 10th year embarking on primary health care in Marampa Chiefdom.
We heard about a strange disease that has come, wherein people were vomiting. I could remember at that time, we stopped going to school for a time. They started quarantining people. Even for me, it affected my family a little bit because my stepmother then fell ill during that Ebola period, and then she was taken to the treatment center, and then she died. We couldn't bury her, and we couldn't see her body again. They said she died of Ebola. Partially, it was that contributed in me going to the medical field, because during that time I see people falling sick and families being emotionally down because they could not care for their relatives. And even the healthcare workers that were helping patients at that time, a lot of them died during the outbreak. I went to Brother Michael, he explained to me, we built a center, but now we need a clinical officer that will go and work there. That was in 2021. He said, so we need someone that will be working there with other nurses that will be sent there later. I hopefully and wholeheartedly accepted. I said I will go there. For me, I was ready to serve. That was the main drive behind my motive of coming here. Just help people. It's a very remote village. It's far from Lonsa, far from city. But I was willing to come here because I wanted to serve. And I knew in my service, as time goes on, things will be better and they will improve along the way.
And this all is due to Juan Ciudad organization in Spain that have made these resources available.
So as a director of St. John of God Hospital, how important it is to train youth in health issues?
Youth in our country, Sierra Leone, they form majority of our population. So we realized youth education in Ebola prevention was very, very useful. If you want to change behavior in health, it's important to target the youth.
So now tell us something about the nursing school.
The nursing school is an original idea of the hospitals. It came because there were no personnel, qualified personnel, to work in the hospital. And Ebola affected a lot of personnel. A lot of nurses died and doctors died. That was what we saw the need, that let's provide a higher quality of education to nurses in this country.
We were in school when Ebola started. People did not believe in the hospital. They said when you go to the hospital, you will die. People believe in science, while some people believe in traditions. So we are having two different thinkings. This thing should stop. In case of pandemic, when there is pandemic, if there is a nurse in the community, that nurse will help. So the way I'm seeing my people suffering, so I decided to say, no, let me change my things. By that time, I was in home economics. Then I go in for nursing. and I do my nursing at this St. John of God Catholic services. With the continuous doing health education to people, we make them to believe in us. Her manners make them to have trust in us. Her manners make them to even believe that science exists. The way you talk to them, the way you counsel them, the way you play with them.
We observe that our nurses, they really need to be given higher education so that better services will be provided to the people.
I like working in the hospital. I have passion for my job. So that is my expectation. I will do anything for my patients. I will do my best. I will do everything for them.
To accept family planning.
Are you now prepared for any similar episode of an outbreak of any disease of short nature? Are you prepared to face it?
Yes, I think with the support of our partners, especially Juan Ciudad on our side at all time, we are prepared. In fact, what we have established in the hospital now, we have focused on infection prevention and control structures. And we have a focal person who is responsible to monitor how the staff are promoting and handling infection prevention and control. We are resilient now. That's why when COVID came, no staff died.
That is Brother Michael, the director of St. John of God Catholic Hospital, speaking to Radio Lone Star Frequency Modulation 99.1 from Sierra Leone. Now we are going to connect with Brother Peter Lansana, the director of the Catholic St. Joseph Hospital in Liberia, for a continuation of our story.
10 years ago, from the first announcement that Ebola is in Liberia, how do you think about the lessons learned? How do you put it into words?
Based on the experience of Ebola outbreak in 2014, we have learned on how to keep a hospital that will be able to attack any disease outbreak that may come now or in the future. We need our partners, and through their help and support, we remain resilient also to work and ensure that future outbreaks are well managed under us, and the population will be safe in our care.
Many thanks to our guests today for their testimony both here in Liberia and in Sierra Leone, as it has allowed us to remember all of those people who lost their lives and those who survived. It is because of this exercise of remembering, it allows us to understand the past in order to be able to project a better future. My name is Isaac Marcus Carter, the host of Health Talk on Radio Maria Liberia.